Hello, welcome back to my channel. Nurse Marsha here. And you see I have on my Be Well gear because Nurse Marsha wants you to be well. In my last video, we talked about stress and anxiety, and I gave you some tips on how to better manage anxiety. But people, if anxiety goes untreated, it can lead to depression. So today in this video, we're going to talk about depression. I'm going to tell you what it is. I'm going to give you some signs and symptoms so you can recognize if you're depressed. And also, let's talk about treatments for it. Let's get started. You may ask, what is depression? Do I have depression? Depression is a mood disorder, and it can cause you a wide variety of different types of emotional ups and downs. You're going to have a persistent sadness and loss of interest in doing things that you normally enjoy doing. It can be called major depressive disorder, or it can be called clinical depression. It can lead to physical problems. And like I said before, you're going to have a lot of emotional ups and downs. It can affect how you feel and think. Feel, think, and behave. You may start having trouble with getting through your normal day-to-day activities. So let's talk about symptoms. Symptoms of depression is feeling of sadness, a persistent feeling of sadness, lose interest in things that you normally enjoy doing. You may have some periods of crying spells or just being tearful. You're going to have trouble sleeping, either sleeping, too much sleep, or not getting through the whole night, interrupted sleep. Lack of energy, tiredness. You're going to either overeat or you're going to have no appetite and you're going to lose weight. You're going to have anxiety, you're going to be agitated, restless, you're going to be easily frustrated, and the littlest things will make you fly off the handle. Some people call it low tolerance. You're going to start feeling unworthy of the better things in life. You're going to start feeling guilt. You're going to start feeling like you don't deserve anything positive. You're going to have feelings of nothing goes right for me. You're going to be stuck in the past in a sense. What I mean by that, you're going to be fixated on your past failures, and you're going to begin to blame yourself. Poor concentration, forgetfulness. It may lead into frequent thoughts of not wanting to live, feeling unworthy to live. Life is not worth going on. Let me stop you. Let me stop right here. You are worthy, and life is worth going on. So if you have these feelings of not wanting to live, that is an emergency, and you need to call 911. You can also call a 3-digit suicide crisis hotline, 988. 988. I'm going to leave in the description below some resources to help you find help for depression. When to seek help. Just like I said before, if you're having those serious symptoms of not wanting to go on, life is not worth living, maybe I'll be better off dead, that's a medical emergency. And you need to call 988, which is a toll-free 988, only 3 numbers for suicide prevention and crisis center. And you can also call 911 and get to the emergency room. The other milder symptoms, when it becomes crying spells. You're going to get to the point that you're going to cry at the drop of a hat when you're having trouble at work, trouble in your personal life, easily agitated, restless, poor sleeping, interruptions in what you eat. You may even want to overeat or seek salty or sweet foods. When it disrupts your daily normalcy, then it's time for you to call and get an appointment to go see your primary care physician so you can have a clinical assessment, a professional assessment, and get into treatment. Some of the treatments can be medication, lifestyle changes, and therapy. Now, I've been a nurse for over 30 years, and it is so common for me to have patients that say, I don't want to take any medications. That medications is for crazy people. Let me tell you why medications are important for someone that's having these symptoms of depression. The medications are going to get you out of that symptoms. It's going to get you out of the symptoms of depression, such as not being able to sleep, easily agitated, restless, poor thinking, not being able to make a decision, options with work, home, and your personal relationships. It's going to get you out of that thought of it's not worth living. That's what medications are going to do. And so your doctor, more than likely, depending upon your severity of your symptoms, might add some medications right away. He or she is also going to advise you to get into therapy, refer you to therapists. What is my therapist going to do, or what is the therapy going to do? First of all, the therapist is going to allow you to talk, get it out, get it off your chest. Therapists are going to start being able to teach you how to have some coping skills to manage those negative thoughts, to replace them with positive thoughts. Talk about lifestyle changes, why it's important to eat properly and get you some exercise in order to help with those negative, sad, depressive symptoms. Because when we exercise, it releases hormones in our system that makes us feel better. It lights up the brain and make the brain start feeling good. And guess what? Exercise don't cost you a thing, right? So, again, I want you guys to take depression seriously, because 16 million adults in America each year suffer from it. That's 1 out of 6 adults. Also, again, in the description below, I'm going to leave you resources for you to get help. Always, always start by talking to your doctor. The earlier, the better. If you're in a crisis mode, call 911 or 988 and get in to get you some treatment to get you out of that depression and those symptoms of negativity that could cause you some serious complications. So I hope I've been helpful. Please consider subscribing to my channel, hit the like button, and leave a comment. What do you think about this? What topics that you would like for me to talk about on the next videos? Again, I want you to be well. Until next time.